Well, hello, everyone, and welcome to another episode of The Pulse, where we talk to digital health leaders, experts, influencers, and entrepreneurs from all over the world. Super excited to dive into conversation with our guest today. Just before that, a quick reminder to follow our LinkedIn page for updates, subscribe to our YouTube channel, and we're also on 6 different podcast channels, including Google Podcasts and Spotify. I'm your host, Dr. Maida Afan, and today we have with us Howard Rosen, who is the CEO of Nova Insights, which is a health IT advising and consulting firm. He has 30 years of extensive industry experience and has been featured by Forbes and other renowned publications as a leader that believes in humanizing digital transformation, which is definitely something that we're going to touch upon in this episode. Welcome to the podcast, Howard.
Well, thank you so much, Maida. I look forward to talking with you today.
So I can see that you have been involved in various areas during your career. And just to give our audience a little bit of context, can you please walk me through your background and tell us a little bit about how you ventured into health IT?
Well, very quickly, it's maybe a slightly unconventional approach. The overview is by education, I have an MBA in international finance and marketing. I spent 20 years producing film and television, and naturally I fell into health IT. What else do you need to say? It seems self-explanatory.
Well, interesting.
A little bit of context.
Yes.
Perhaps a little bit of context is I spent about 20 years, I said, producing film and television, and I was expand the company in the area of continuing medical education. One of the areas was dealing with diabetes, and really this is in 2005. Looking to sort of see what was being done, how pervasive it was, and how pervasive it was going to be. And really just sort of going, well, what's being done? And a lot of cool solutions, but very low utilization. And being a card-carrying, arrogant film producer, I said, well, all you got to do is come up with a solution that deals with people's lifestyles. And then they'll be more oriented to dealing with their diseases. And I went, okay, cool. Right. I took care of diabetes. I wonder what else I can do today. And didn't think about it until about 6 months later, when I was doing some promotional campaigns regarding cell phones and mobile devices. And again, remember, this is 2005, and they're saying sometime in the future, you're going to be able to put programs on phones, and you're going to be able to do things like tell the weather. And we said, well, what a crazy idea that was. But thinking about it, I went, well, you know what? Maybe cell phones will be the future for patients to be able to manage their diseases. Because they'll from my background, it'll let patients, instead of being told how to do things, how to communicate, maybe this is the way for the patients to take control and say, this is how I want to communicate. And that little idea in 2005 evolved into LifeWire, which was it's become a cloud-based communication platform that really allows patients to choose whatever device they want, whatever means of communication they want, to have that engagement. That first piece
amazing.
Of empowerment.
Well, I mean, excellent segue into my next question, which is about patient engagement. And so I can tell, I know that you know what patient engagement is. I know what patient engagement is, but just for our audience and to simplify it, I'd like to take a brief moment to elaborate on what patient engagement really is, right? So it's not only confined to the interaction of the patient with a mobile app or with a digital tool. It's really about empowering the patient and, like you said, involving them and giving them the needs and the information to make more informed healthcare decisions. And so with so many patient-centric solutions hitting the market, Howard, there's still a low adoption rate and the patient satisfaction rate is still low. And in your experience, why do you think that is?
The quick answer to extremely long question in terms of and where that leads to is a lot of the solutions have been developed where the patient's the afterthought. Let's go, well, this is going to be good, let's communicate, as opposed to involving the patients from the early design stage, from collaborating with the patients to get them. Because the problem is, yes, any solution, almost anyone will use any app or whatever for 2 weeks. Then you get them, that's when the drop off happens, because really it goes, okay, now it's no longer a shiny object. Now it's like, it's a pain in the butt to use it if I'm not getting value. So it's looking at realizing it's not build it and you've done, it's build it and continually dealing with it and building it and feeding it, which is on a collaborative with the patients. The patient's always getting insights, always getting whatever they need to help them with their healthcare journey. And also a solution that's got to be all encompassing, not necessarily just the patient, but also their caregivers, their ecosystem. And frankly, and I could talk a lot more about involving the entire stakeholder system.
Yes, because, and I think this is where the healthcare's unique challenges come in, right? The intricacies of the healthcare system is because it has multiple stakeholders, including the providers, which we often forget are also the end users here, right?
Exactly. Right. Well, yeah, go ahead.
No, go ahead, please.
No, I was going to say that, and that's obviously part of you talk about my concept of humanizing digital transformation. It's a real mouthful. The key word's actually humanizing, because the thing is, when you're doing these implementations, when you're providing solution sets, or actually enablers, not solutions, people forget, as you said, the providers. You actually have to understand your customers, because let's say it's a health system, you have your customers, you have two forms of customers. One's external, which are, yes, absolutely the patients and their ecosystem, but you also have an internal customers, which are your providers, your clinicians, your nurses, your techs, who are part of that process. And unless they're involved and engaged in that process, that becomes the weakest link in the chain, and that's becomes part of your low engagement. You're hearing a lot about, after post-COVID, they're saying, well, we did all this telehealth, but really there's no interest. There's a lack of interest in patients who are doing it, so we're going to go back face to face. There's a difference between the word interest and desire. There's no interest in using the solution as been created and provided by the provider. There's a desire to use telehealth and all these solutions if it actually addressed their needs and engage them the way they want to be engaged.
Very good point, because I was actually going through a couple of researches and studies and clinical trials done, and there's actually the National Health Survey, for example, in the US shows that 66% of Americans are willing to use some sort of mobile app or some sort of digital wearable to track and monitor their disease. Up to 90% of patients are interested in some sort of technology-based intervention, but yet the mobile app downloads remain low. The 90-day, you're saying 2 weeks, but in the study was a 90-day user retention rate remains
I know.
low. Yeah. And so now we know that these pain points have been identified. How do we go about solving them and addressing them in a pragmatic manner to really improve the patient experience and get them to start using these tools?
Well, one thing that I did, and actually did early on with LifeWire, with our clients, and some kicking and screaming, was actually taking some of the tools from my, my other old business in terms of film, which is using focus groups. What we did before every implementation, we actually did a focus group with the user group. Yeah. And even though, we had some cases, we had, clients who'd say, no, this is perfect, they don't need to, let's do it anyway. We literally forced them to do a focus group, and they'd see the response, which was insanely low. And then they started using themselves, and they went, holy mackerel, I didn't realize. And because when you're dealing with communication and engagement, McLuhan said the message is the medium. It really is. If you're going to use text messaging, for example, you have to communicate one way. If you're going to use WhatsApp, it's another. If you're going to use an app, it's another. Each one actually has to have its unique way of communicating to address the needs. And similarly, people get, when they're talking to somebody who's a peer or a clinician, in the question set, and that changes directly as well, a lot in terms of how they're going to respond. And so there's a lot of, anecdotally, a lot of things that we've done, some studies and some just from our experience, in terms of how you do those things. But to your point, it's, who knew healthcare would be so complicated? It's insanely complicated because you're dealing with humans, you're dealing with emotion as part of that process, and behavior as another part of that process.
Behavior, exactly. So something that I tell my clients all the time, coming from a marketing background, is that your target audience demographic or your patient demographic is one thing, but the psychographics are completely different. You have to understand them from a psychological point of view. But when you say focus group, I'm so glad I'm happy with the direction this conversation is moving in. And you mentioned focus groups. And this essentially applies that, well, if it's about the patient, you should at least talk to the patient before you design the solution or enabler. First of all, what is the difference between enabler and solution? How do you make them different? Why are they two distinct? And doesn't it take a longer time to engage the patients in focus groups? Because there's a largest talk about hitting the market and competition and just quicker to market, right? This is, I think, where health tech companies are falling short as well. What do you think?
Yeah, absolutely. Oh, without any question. In terms, so in enabling and solution, enabling a solution seems like is a finite element. It's like here it is. To me, an enabler goes back to the point of engagement. Enabling means, oh, I'm enabling the patient to do these things, as opposed to just a finite, I just want to collect their data. I want to know how they're feeling, or I want to know what their A1C is. As opposed to enabling, it's a different approach to what you're providing, because you may need a number of solutions to enable a patient, if you know what I mean. Like, I think it's a much more proactive approach to what you're supposed to be doing. In terms of focus groups, taking more time, again, it's all design. It won't take much more time than it would if it's incorporated into your process to begin with. If you've got a process, then you're going to stop, and then you can do a focus group, and then you go on. That perhaps could take more time. But if you have focus groups, patient collaboration, provider collaboration from the outset as part of your process, it's not going to take you that much more time. And then the other question is, what's time versus utilization? So you say, I'm going to save 4 weeks, as an example, because you can get it out quicker, and you get a 20% utilization rate, versus if you use a focus group approach as that example, and you can get a 65% utilization rate. I'd argue there's a trade-off there. It's worth spending 4 more weeks as part of the process to get a much higher utilization.
Excellent point. And so while we're talking about health tech companies, Howard, what do you think the immediate needs of the patient of today are? What do health tech companies need to focus on? Is it patient provider access? Is it specialist consultation? What is it?
Can I say yes to everything?
Yeah, please, by all means.
Well, the part of the problem or the issue is, it's multiple of issues, but we've got patients, but we're people, we're consumers. We're consuming in other industries. Healthcare is not the only thing we're consumers in. We're consumers in other industries. In almost every other industry, we have insanely engaging apps, engagement tools, and everything else that we're already engaged and involved in, using finance, for example, or Amazon is another. Healthcare is our frustration point, because how come we can't do the same thing we're doing with our bank with health? So it's a massive frustration point. And because there's so many examples outside of what we can do already, every one of them becomes a pain point or point of friction. If you want to zero in on a point of friction, start from the beginning. It's our access to our provider or the health system that, I guess today it's called digital front door. Tomorrow will be another name, of course, but today it's a digital front door. And it's okay, what is my means of getting inside to getting the care or the information that I want? That triage to be able to enable what we need to do.
Right. But I think another concern that patients have is around patient privacy and patient security, and how securely the data is transferred, and their own access to their own medical records.
Absolutely.
And so how do we address this pain point? How do we make sure that data is centralized? How do we make sure that it's securely exchanged between providers and within that care system or the care teams and among different stakeholders?
It's a very interesting question. And again, I'm a firm believer, obviously, in privacy and security. What my solutions have always built, bolted really well to deal with that. I've always made sure we're high trust certified, for example. So the certifications you can do to tell a patient, we've got all these certifications, and so you're taken care of. It's really more psychological than anything else. And it's generational, to be honest. Different generations have different concerns over security and privacy. I would argue boomers are extremely concerned about security and privacy for a whole number of reasons. My millennial kids are less concerned, more because they know everything anyway. So it doesn't matter that they know what temperature was yesterday. So there's an attitude. So it doesn't mean you don't have to have security and privacy, but the concern differs based on the socioeconomic group and demographic you're talking to as being an issue. And it absolutely has to be developed. I think, one way is It's a tough question because it's these designations I mentioned. High trust is certainly as a certification, so like we're high trust certified. The average person doesn't know what that means. It
Yes.
doesn't mean anything to them. It's
Yeah.
really more, it comes down to trust. Do I trust who's telling me to use this? If my provider says use this app or use this platform, do I trust the provider that, okay, they're doing their best information, that this is the best solution? Because the other side is, when we've done utilizations, I've worked with the US military and everyone else, whenever we go through the various audits, it's not if you get hacked, it's when you get hacked. What are you doing? What's your processes? So it's kind of, to your question, it's sort of commonly thought that, okay, there's going to be a hack, what's going to happen to my data? So I said, it goes back to that trust factor. Do you trust the source of using this, or trust the source of where it comes from?
Right. And
that's
so
all you
I
have.
guess, no, that makes sense. And I guess that's where provider advocacy comes in. And in order for the provider to advocate for it, you have to involve the provider as well in the design process. And so I know that you've worked on a communication platform for female vets in the US in collaboration with clinicians for their maternal health for female veterans who suffer from PTSD and other maternal health issues. It's amazing. Just tell me a little bit about that. What did it entail? How was your experience working with clinicians on this platform, and what value did they bring to the table?
Well, it was an honor to work with them. Is because I didn't know any better. My first client was the VA, and so we were working in the area of post-traumatic stress to start with. And then we happened to be introduced to the woman who was running the maternal health program in Sacramento, and Dr. Nancy Brown Connolly. And she said, this could be really interesting because I've got a population, which was combat trained female vets suffering from post-traumatic stress who are pregnant. And with that population, there's a 78% probability of a suicidal event, not necessarily successful, but an event nevertheless. It's just horrific. And so working with the clinicians, basically part of the issue was they had 28 assessments they had to do over 18 months, and which required women to come into the facility, do these assessments. And just doing that alone was obviously extremely stressful to what they're doing. So working with the clinicians, we worked with them to take their assessments and to put it onto our platform. So the women could go for wherever they happen to be, and with their kids or remotely, because many had to travel 200 miles, remotely, they had the assessments going with them on an ongoing basis, on an automated basis. And because it was rules-based, it was also designed that if there's a change in their responses, it could automatically change the assessments. So basically doing the business rules of the clinician were tied directly to what our system did. So for example, if a woman was doing a test and for stress, and it indicated it was a higher level of stress from previously, based on their business rules, it could automatically switch to a depression scale and do some depression tests. And depending on the results, if it were high enough and it indicated there should be an appointment, the system would automatically ping the depression doctor and set the appointment for the woman. It would send the results to the clinician and send a summary to the supervisor, all on an automated basis, and all at the ease of the woman veteran. So for the clinician, what that allowed them to do, and I could talk about the experience working with them in a second, but the result was, in terms of managing the population, a clinician went from managing 25 vets to managing 150 vets.
There you go.
Now, the difference was, instead of having to call up and contact every vet, she now knew which of her clients she needed to deal with at any point in time. So she was actually more efficient and effective at knowing who to deal with. The veterans themselves thought they were getting better care because their issues are being addressed when, I need to be addressed right now at my level. And quite honestly, the largest honor is during the time that the women were on our system, there was not one reported successful suicidal event.
Amazing. Well, I mean, hats off.
And thank you.
Go ahead, please.
And it was really great working with the clinicians, because of course, as you started using, in this case, the platform, they went, we could do this. Well, how about if we can do this? And our problem was actually containing them from having product creep, because they said, okay, let's add this. They got very, very enthusiastic, which really, obviously, as we were building a solution, it was really it was a lot of fun, but it was really more down to, as I said, product creep, where they said, let's keep on tweaking it. And we said, no, let's, we can stop now. Let's deal and see how this works with your clients. And of course, we were all thrilled with the results.
No, well,
but it provided us, yeah. Right. No, I said really, because what it provided us, because again, we were, it was my idea, we had our developers, but we didn't have the expertise in understanding that population, the sociological elements of it. The clinicians had all that, and that's what empowered and put value to what our platform did. It wasn't a complete platform until we had those pieces in there, and it was always designed to be collaborative to be able to do that. So we were able to enable all the elements and that entire ecosystem. And so that's what I'm doing now, is working with clients. Go ahead.
Yeah. No, I mean, because it was so successful because it checked off all the boxes, right? There was convenience, there was an immediate layer of trust that was established, and it was efficient. And I always say that everything is fair in love, war, and pregnancy. After having 3 kids, I mean, I can attest to the fact that pregnancy in and of itself is an ordeal, right? But to make or design a platform, Howard, that caters to the unique needs of female veterans and their experiences like none other. I think it was an amazing initiative. So thank you for sharing that. And just, I don't want to.
Oh no, it was my honor.
I don't want to keep you for too long, but just before we wind up, I know that you help entrepreneurs and establish healthcare organizations on solution implementation, like you said, and you're in the consultancy phase now. And you do what you call humanizing digital transformation. And we've talked a little bit about that. But really, I was actually going through a couple of your interviews, and there was a common theme that I found in those interviews. And it was really that you're in it for the greater good, right? And so one of the missions of Nova Insights, and please correct me if I'm wrong, is to really make the businesses better, the society better, and then ourselves as individuals better. And I'm just going to directly quote you here, where you say that, I think if we are going to be here for 70 to 80 years, why not make the best of it and for others who follow? And so what does that mean to you? Why is it so important for you to leave that sort of legacy? And what does humanizing digital transformation really mean to you?
Well, I'll answer the last question first. So humanizing digital transformation really is looking at, again, having been on the vendor side, dealing with implementation, dealing with the issues in terms of implementation, again, how brilliant my solution was, they never go as smoothly as you like to go. And then on doing the consulting and actually consulting on the health system, the provider side, working with solutions, I'm now seeing what the implementation problems are. And fundamentally, it goes back to in many cases, it goes through the IT department and they just bolt on the solution. They go, okay, here it is, build it and they will come. Yeah. And there is no, obviously there's elements where they say, oh, no, we bring patients in to try it or we do this, but it's always after the fact. It's never been on their more collaborative process of let's get them involved. We already have, let's say we have a solution. Let's get them involved in how this is going to work within our organization. And similarly, working with the people side of the nurses, the clinicians, whoever are going to be having those touch points of that solution, let's figure out what those areas of friction are or could be. And let's make sure they're smooth by working with everybody so that the process is as effective and efficient as possible. And particularly now with staffing shortages everywhere, it's all more important that we make sure we deal with that, so we're not having people deal with things that really they shouldn't have to deal with. Operating at the top of the license, as opposed to administratively going, well, that person didn't respond properly.
Well, as an entrepreneur, go ahead. Sorry.
Go ahead.
No, I was just asking, as an entrepreneur. Go ahead, please complete your thought.
No, I'm sorry, just the joys of a slight delay in the sound. In terms of the legacy piece, is none of this is easy. And yes, so there's lots of various kinds of rewards. And I guess for me, it's always been, obviously there's always a business good, there's a social good, but really is, I keep a look, I've got 4 kids. and they see me working hard, and I was never with them as much as I would like to do. And so if I'm going to be working that way, you want to be at least provide something that you're building on something and provide something people can build on that can actually provide value. Because that's my perspective, but it's sort of like I want to be able to leave something behind that hopefully I've made a little bit of difference somewhere in some of this. And quite honestly, it's been working with the patients and to the results using the female vets, because it was early on. It was a feeling I couldn't quite understand, had not felt before, in terms of understanding that we were actually making this good. And it's kind of it really becomes going, well, I want to be able to do that again, and help others do the same thing.
Yeah, and as an entrepreneur, with everything going on in the world right now, with the uncertainty, with the economic crisis, with inflation rates, I don't know, call it what you will. As an entrepreneur, what keeps you going on those not so good days? What keeps you motivated? Any message that you have for other entrepreneurs that are just starting out in this space, perhaps?
Three pieces of advice. One is, as you can tell, I'm not a new entrepreneur or a young entrepreneur anymore. I was at one point. So I've been through this road a few times, and with multiple careers, and there's peaks and valleys on all these things. So where we feel today and go, oh my gosh, what's going on? Yeah, we've been through this before. Different circumstances, but we've been through this kind of thing before. But for the entrepreneur, so that what's important is being really clear on that mission. To your earlier question, what is that mission? What are you trying to do? And if you're clear to that mission, to say, this is what I want, and that vision of what you want to go, just use that as your guidepost. And so when you're having to make decisions, and maybe make a decision you didn't quite think you needed to do, but as long as it feeds to that same direction, just keep on going.
Well, thank you so much for your time. Yeah.
I was going to say, because every day as an entrepreneur, every day presents a challenge anyway. So this one is just, it's more clear what those challenges are.
Yeah, and coming from an experienced entrepreneur such as yourself, I'm sure that our audience will definitely find your insights and your advice very valuable, Howard. Thank you so much for your time. I think it was an excellent discussion.
You very much. I thoroughly enjoyed it.
All right, for everyone who's listening, take care of yourselves until next time. Bye-bye.